and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, everyone in our life face a lot of orthopedic problems like back pain, knee pain, etc. So to discuss on various orthopedic problems, we have with us in studio Dr. Rakesh Das, consultant orthopedic from Hayat Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Thank you so much, Dr. Rakesh, for coming to Good Life, the health show. So we have been talking about lots of things, but orthopedic problems is one kind of problem. Everybody in our life, we face one at a time. So let's have a discussion, or let's start with initially that there are various kinds of orthopedic problems. There are some common orthopedic problems. So what are they and how to start with?
Yes, if you ask me the common orthopedic problems, then it's the back pain, because literature says almost 90% of the population suffers from back pain once in their lifetime. And after that, it's the knee pain, osteoarthritis or whatever. The knee pain is the second most commonest orthopedic problem.
Okay.
So we have other problems also. For example, joint pain. That means rheumatoid arthritis, other types of pain. We have fractures, all those types of problems.
All right, so lots of problems are there related to orthopedic, and we are going to discuss some of them as well. But back pain is one of the common problems which everybody in our lives face one at a time. So let's talk about that, doctor. Back pain, it's very commonly seen, and it's seen in every age groups. It's not been barred nowadays in the elderly group. Earlier we used to say that, okay, the elder people will have a lot of like back pain, but it's been seen in younger generations as well. So what do you have to say on it? What could be the causes, symptoms, and what we can know about back pain?
Yes, as it was previously thought, it is more common in elderly age groups, but to the contrary, it's more common in young people now, because of the lifestyle work habits. So most of the people now, they are doing sitting jobs, office jobs. For example, we all the time sit in the office and then we have to do the jobs.
Right.
Okay. So that type of sedentary lifestyle that causes more of the back pain because of bad posture while sitting. So there are a few precautions which if you follow, then you can avoid your back pain.
All right. So we need to change our lifestyle as well.
Yes.
Isn't it? So we need to change our lifestyle to have a proper lifestyle, and if we need to be good and we need to have a good lifestyle, so for what we can do is like we need to change some of our routine job, and if we are sitting a long time and doing a certain kind of job, so we can just have a relaxation from the job as well.
Yes, that's the most important point which you told now. So you should not sit
continuously
at a stretch,
at the same position.
Yes, at a stretch you should not sit. So you should take a gap in between. For example, every 1 to 2 hours you should just stand up. You should just then stretch yourself, your back, your hands, your arms. You should stretch, and you should, for example, this is a chair. So this is a very important point. For example, most of the time what we do, we stoop forward and we write or whatever you do.
Right.
So this stooping forward is not good.
Okay.
You should always put your chair, front, keep your back straight, and then you can write. Okay. So that is the ideal posture of sitting in a chair and doing your work. And you should always take a break in between 2 hours, then stretch yourself.
All right. So a break in your work, between your works, is very important to just reduce your back pain if you are having a severe back pain as well. So like if a person is having a back pain, how will that person know? Is it going to be a severe kind of it, or how to reduce that stress, or how to reduce that pain, and what could be done? So there might be some symptoms to know. So what are the symptoms, doctor?
So this is a very important point, because most of the people have back pain in their lifetime.
Okay.
So they should know what are the alarming signs. Okay. So there are many causes of back pain. Okay. For example, most important cause is muscle spasm. For example, suddenly you fell down, you had a stretch, so a muscle goes to spasm and you have a pain. So that pain usually doesn't persist for more than 5 to 7 days.
Okay.
So if your back pain persists for more than 5 to 7 days, yes, you should consult your doctor. Second is, if you are having any neurological pain, for example, radicular pain radiates to any of your legs.
Okay.
So that's an alarming sign. You should consult your doctor. Then second is that more than back pain, sometimes we have cervical spondylitis.
Okay.
So that is also important point, because now most of the people are, they are used to do computers. Now digital world, everyone is studying online. So most of the time, students and who are doing job, they have to see in the screen of the computer.
Absolutely.
And their neck is always in flexion position. So that means we do like this.
So we don't sit straight and
Straight,
work. We
yes.
just lean sometimes and then we
Yes,
work.
yes. So if you flex your neck most of the time, then you will have your pain in the cervical spine. So we should not always keep the back your neck in the flexion position. We should sometimes stretch in between and do some rotation
Stretching exercises as well.
of the neck. So that's very important. And in the back pain, these two symptoms are very important. If your pain persists for more than 5 to 7 days, consult a doctor. And if you are having a regular pain, that means pain going to from the back going to your any of your legs, you should consult a doctor.
All right, doctor. So, what would you like to tell the viewers about the diagnosis part of the severe kind of pain, or initially when can a person, or when is the time to see a doctor if you are having any kind of a back pain?
Yes. So the most important cause of the back pain is muscle spasm, which is not very problematic. It goes off by itself with some medications, or with rest it goes off. Second most important thing is that neurological problem, if you have, we have to go for an MRI, to see any nerve involvement. Then the third is that you can have any infection. In India, we have tuberculosis infection is very common.
Absolutely.
Osteomyelitis of the bone. So that we have to rule out by doing an MRI. And then we have some fractures also sometimes. In elderly age group, yes, osteoporosis is very
very
common,
much seen.
much common.
Yeah,
the bones get softened. Osteoporosis is the reduced calcium in the bone, and that makes the bone malleable, softened. So the bone in the elderly people breaks by itself. So that is called osteoporotic fracture. So that is also one of the important cause of pain in elderly people.
So if these kind of persons, whenever they visit a doctor or whenever they visit any hospital to get a further consultation about how severe is the pain, so what is the first thing a hospital or a doctor, suppose if any patient comes to you, so what is the first diagnosis part, what is the process? So let's know about that.
If a patient comes to us with a back pain, first we do a clinical examination. That means we first assess the patient. What is his complaint? So that's the important.
Proper detailing
history we take, and how it started. Then we examine the patient. So we first rule out if there is any neurological problem. If there is a neurological problem, we always advise an MRI. If the patient is not having neurological problem, if the pain is not that chronic, that means pain is started 7 to 10 days, and there is no neurological problem, we don't advise an MRI. We just advise her bed rest. Avoid forward bending. Yes, in back pain you should not bend forward.
Some positions are also mentioned to them, how to sleep or how to sit.
Sleep, so bending forward is not good for back pain. It increases the pressure on your back. So you should not do forward bending works while you are having back pain, and you should not lift weight. And you should always keep your back straight. And if you are having severe pain, best thing is to have a bed rest. That means you should be in lying position. Sitting in a chair is not a rest. That means you have to lie down. So we advise 3 days of bed rest.
3 days of bed rest.
And avoid bending forward, lifting weights, and we have prescribed some muscle relaxants. Along with, if the pain is severe, we sometimes also prescribe painkillers along with that. And sometimes if the patient has neurological problem, we also advise neurological medicines.
All right. Doctor, we have a phone call, so let's take the phone call first. Hello. Hello,
ma'am.
हाँ, आप अपना question करिए.
Ma'am, actually my auntie, she suffer from the slip disc. Can we treat them?
Slip disc.
Yeah.
Okay.
What is the age to नको ले? ठीक है सर.
What is your age? Can you please tell your age?
Age 45.
45. Okay. From where you're calling?
From Shillong.
Okay, from Shillong. Thank you so much for calling. So, doctor is here to give you the answers. How to treat slip disc? Please mention out.
So she specifically told that she is having a slip disc.
She's online. You can ask her the
Okay.
question.
So have you done MRI?
Yeah, MRI not, but the X-ray already done. The X-ray, when we show the doctor the X-ray, they say like that. Only the slip disc only for the back pain.
Okay. Do you have any pain going to your legs?
Leg also, yeah, but she cannot walk also because of that. She has to lie down on the bed only.
Okay, so she's talking about her mother.
Okay, she is talking about her mother.
Ha, ha.
Okay, see, if you have not done an MRI, but you are telling that your mother is suffering from slip disc. Okay, so how long she is suffering from this pain?
Now already 2 weeks.
2 weeks. So it's not that a long duration. Okay, and she is not having any pain in her legs.
Not pain in her leg, only the back pain.
Only
only.
the back pain. Yes, yes, yes.
Yeah.
Yes. So she should not have slip disc actually, because the slip disc, if you usually have a neurological component. That means one of your legs will having tingling sensation. So that is important. And chronic pain in the back without any neurological involvement, we have to rule out some other causes. She might have some other problem. For example, any stress related fractures, okay, and any other causative findings we have to find out by doing an MRI.
So unless and until a process or a MRI has been done, so we can't rule out what exactly is the matter. But thank you so much for calling. But if she's of the concern that it's about these slip discs, so what could be done in that mode, doctor?
We have to first confirm it by doing an MRI.
Okay, if it is a slip disc,
Yes.
then
No, now there are levels.
Okay.
Most commonly it affects the lumbar spine. In the lumbar spine we have 5 levels.
Okay.
Okay, L1, L2, L3, L4, L5. Most of the time you will hear people saying I have a slip disc of L4, L5.
okay, that's a term
Yeah,
they
that's
use
a term.
it. Okay.
Yes, yes. So that means the disc is slipped between the L4 and L5 vertebra. So if in the MRI we have got a grading of slip disc 1, 2, 3. So the last grading is extrusion. That means initially there is a bulge, then there is a protrusion, and then there is an extrusion. If there is a bulge or protrusion, we don't advise for an surgery. Okay, that means with rest, physiotherapy, medications, the patient should improve. But if the disc is extruded, that means the disc has come out of its sac
Okay.
and it's lying outside. Then we advise surgery. That
Okay.
it will require surgery.
So if you advise surgery, so is it like safe? Surgeries are safe because whenever people they listen about surgery, so they
Yes,
get
yes.
scared. So surgery is for the extreme kind of patients, like
Yes.
whoever is. It's not for everyone.
Not for everyone. Only 5 to 10% of the people require surgery. Because I told you 90% of the people will have back pain
All right.
once in their life.
Doctor, we have a phone call. Let's take the phone call first. Hello.
Hello.
हाँ जी, अपना क्वेश्चन करिए. हेलो.
हाँ, मेरा क्वेश्चन था कि 2 years बैक मुझे चोट मिला था बैक में, तो उसका पेन अभी भी है, तो कैसे रिलीफ मिल सकता है?
ओके, आपको स्टिल पेन है.
हाँ, बैक पेन अभी भी.
ओके, व्हाट इज योर एज?
My age is 24.
25.
24.
24. Okay. So still you have pain, but 3 years back you have got hurt in your back. Okay. So still she has pain. So what could be done? So doctor is in our studio. He will give you the answer. All right, doctor.
Yes, I'll say most of the time we have patients in our OPDs, young patients come, but we do a lot of investigations, we do MRI, we do blood investigations and everything. Even after that, we don't find any significant cause. For example, the spine is perfectly okay, there is no slip disc, but even then the patient complains of pain. So, most of the time at that time we find the patient might be having some deficiency of vitamin D. So, vitamin D deficiency also causes back pain, muscle cramps and all those things. So, we have to do a holistic approach. That means we have to exclude one by one. If sometimes the patient is not, nothing is positive in MRI findings, but even if the patient complains of pain, then we do blood investigations. Sometimes uric acid also causes back pain, it can cause vitamin D deficiency.
So that can be assessed by doing a proper diagnosis,
yes,
and by a proper test as well.
Yes.
So if she is online, so you can ask her directly that have she gone through any MRI or something like that.
Yes. Have you gone through any investigation?
Yes, yes, I have gone. I have gone to hospital. I have consulted with doctor, and even X-ray was done. And after they have done the X-ray of my back, and saying that जो कि मेरा spinal cord जो हम लोग का curve shape में होता है, मेरा spinal cord वो straight हो गया. तो मुझे बोले कि वो लोग 3 exercise दिया था, बोला कि ये seriously mindfully तो आपको रोज सुबह exercise करना. तो मैंने किया.
I can't understand actually.
All right. So you have been asked to do some exercises which has been advised by the doctor who has done your test.
Yes.
Okay. Okay. So are you taking any medicines as well?
No medicine. Just for doctor has given me some vitamins as my hemoglobin was low.
Okay.
So I'm fine.
Her
Now
hemoglobin
I'm not
was less.
taking any.
All right, so there are lots of factors. Her hemoglobin was less, so
Yes.
she has been asked for some freehand exercises as well.
Yes, yes.
So you can ask her directly and advise her directly as well. She's online.
Yes, you can, because you are young, you are 24 years old, so you can do your vitamin D test, serum vitamin D test, because vitamin D deficiency also causes back pain, and you should do proper physiotherapy. Okay, spinal extension exercises. Your physiotherapy will advise you properly what are the exercises to be done, and you should not bend forward and lift weight, because most of the time we find in our 50% of the patients they don't have any problem. These are all postural problems. So if you follow your posture properly and you do your exercises properly, and if you have some deficiency, for example you are having hemoglobin deficiency, check your vitamin D level. If you replenish those deficiency factors, then I think you should be okay.
All right. Thank you so much for calling to Good Life, the Health Show, and keep calling as if you have any kind of problem. And viewers, our numbers are flashed on your television screen. So if you have any queries regarding the topic which we have taken today, like orthopedic problems, and we are specifically talking on back pain today, and we will also touch upon some doses on knee pain as well. But if you have any queries, do join us as our numbers are flashed on your screens, and call us as Dr. Rakesh Das is in our studio and he will give you the answers. All right, coming to you, doctor, again. So we had an idea about if a person is having slip disc, so what could be done. There are certain levels as well,
Yes.
and it also depends at which level will need a surgery.
Yes.
So that is a part. So let's come back to the back pain as well again. So the lifestyle which we are leading, it's totally busy. Everyone is having, sometimes people are sitting for quite long hours on the same position and doing a long hours and hours of job.
Yes.
So that might also cause back pain. And if you have a back pain, so there are certain things you should not do.
Yeah.
Like when you go back home, you should not lift heavy weights and
Yeah.
all. So there are certain precautions that has to be taken at this point in time. So what do you say whenever any patient visits to you after they are done with their treatment, or any medicines are be given, and painkillers especially? It's a very habitual thing that people, they take a painkiller and the
Yes.
pain gets
Yes.
eased, so they think that everything is okay. So what do you have to say on that?
Most important thing I want to say that the people has to be fit now. Most of the people are now fitness oriented now. It has come in India now very recently. So you should not be overweight. So
Okay.
overweight, if you keep on putting your weight, then it creates a lot of pressure on your spine. So you should avoid being overweight. So you should do proper exercises,
Okay.
regular exercises, so that your BMI remains perfect. So if your BMI keeps on increasing, then your metabolism rate decreases, and you get overweight, and you have a lot of problem in your spine. You will definitely have problem in your spine.
Okay, okay.
Even after surgery also, because I told you that in the spine we have few levels. So we do surgery specifically of one, sometimes of the 2 level. But if you don't take care of your body, so you can have the problem in other level.
All right, doctor, we have a caller waiting for us. So let's take the call. Hello.
हेलो
Yes.
हाँ जी
हाँ,
मैं
हाँ, जी।
अरविंद जैन हूँ मेरा नाम अरविंद जैन है मैं दीमापुर से बोल रहा हूँ
हाँ जी, अपना प्रश्न कीजिए. हेलो.
हेलो।
हाँ हाँ, अपना क्वेश्चन कीजिए, हम सुन रहे हैं.
गुड आफ्टरनून डॉक्टर साहब
गुड आफ्टरनून. बोलिए, आपका प्रॉब्लम बोलिए.
मेरा जब शाम हो जाता है ना शाम होने से नी के नीचे से दर्द होना शुरू हो जाता है
हम्म.
ये जो नी के जो मसल है ना नी के नीचे में जो है
नी के नीचे,
वहाँ से दर्द
घुटने का नीचे.
घुटने के नीचे से वहाँ शाम होते ही दर्द होना शुरू होता है
हाँ. आप नीचे बैठ सकते हैं?
हाँ बैठ सकता हूँ सर, ज्यादा देर नहीं बैठ सकता, 10 मिनट से ज्यादा नहीं बैठ सकता।
हाँ, आपका आपका उम्र कितना होगा अभी?
सर 48 ईयर्स।
48 ईयर्स, ओके, ठीक है, ठीक है। सो सो दैट्स, आपका वेट कितना होगा?
सर 66।
66, ठीक है। सो knee pain at his age is also very common.
Yeah, you can reply to him. He's
Okay,
online and
okay.
in his comfortable language as well.
हाँ, आपका जो नी पेन है, घुटने का दर्द है, वो आपका एज में थोड़ा कॉमन है, ठीक है। 45 ईयर्स के बाद में नी पेन शुरू हो जाता है, उसको ऑस्टियोआर्थराइटिस बोलते हैं हम लोग। तो आपका एक्सरे करना पड़ेगा। एक्सरे करने से आपका जो घुटने में कभी कभी क्या होता है कि बोन घिस जाता है, तो उसको देखने से पता चलेगा कि आपका कितना घिसा है, और उसके बाद में आपको एक्सरसाइज या कुछ एडवाइस कर सकता है, मेडिसिन एडवाइस कर सकता है, लेकिन उसके लिए आपका ज़रूरत है। कभी कभी क्या होता है कि बोन नहीं घिसने से भी पेन होता है, तो उसके कारण आपका टेंडनाइटिस बोलता है हम लोग, हैमस्ट्रिंग टेंडनाइटिस होता है, क्वाड्रिसेप टेंडनाइटिस होता है, वो आपको देखने से पता चलेगा कि आपका प्रॉब्लम क्या है। ऐसा नी पेन का कारण तो बहुत है, लेकिन प्रॉपर इन्वेस्टिगेशन करके पता कर सकता है। हम आपको एक एडवाइस दे सकते हैं कि आप नीचे ज़्यादा मत बैठिए, नीचे बैठने से आपका नी पेन बढ़ेगा। सो नीचे ज़्यादा मत बैठिए और ज़्यादा स्टेयर्स क्लाइंब मत कीजिए, नॉर्मल पैदल चलने से कोई प्रॉब्लम नहीं है।
All right. Thank you so much for calling to Good Life, the health show. So knee pain is also one kind of problem which like almost everyone faces.
Yes.
And because of like walking through the stairs and
Yes.
like a long stairs, or maybe it's like sometimes with the heavy weights or with the hitting gym. So there are a lot of problems we see in the younger generations as well. But these kind of like problems which we see in certain kind of ages almost common, isn't it, doctor?
Yeah. So if we specify according to the age, so younger people usually have other problem, and the older people has some other problem. Okay, older people from 50, you can 45 to 50, the pain starts due to osteoarthritis. That means there is erosion in the bone. Okay, cartilage damage is there, and the pain is there. So that pain is age related. That
Okay.
means with age there is degenerative process.
Okay.
So everything ages. So your cartilage, your bone also ages.
Okay.
So you will have pain. So that is one cause, and by proper investigation we can find out and we can treat it properly. Second is that osteoporosis. So osteoporosis again is for more elderly people.
Okay.
That means it's around 60 years. So that is also decreased calcium level.
Okay.
That causes the osteoporosis, softening of the bone. So that is also important cause of knee pain. And in the younger generation, the causes are different. So it's most of the time it's a sports injury or fall, history of trauma, any accidents, any sports injury, or deficiency of some vitamins, for example vitamin D, or the cartilage problem. So that are more common.
Absolutely. Nowadays, we see a lot of deficiency in,
Yes.
suppose if we talk about not only bones were related with calcium or something like that, or maybe, but nowadays we see vitamin D deficiency, so a lot kind of problems. So unless and until we go for a general checkup, that is very rarely seen, unless and until you are ill or you have some kind of problem, then only you go for a test, and then you come to know, oh, I have a vitamin D deficiency or some kind of other
Yes.
problems as well. So what do you suggest, doctor, like how to lead a balanced diet, because diet has also played an important role
Yes.
in our lifestyle as well, and we are really short of time, so if you could give some of the tips to our viewers that how could they lead a normal life. And talking about the diet, as you were earlier mentioning about regular exercise as well,
Yes.
and also a balanced weight.
Yes.
Okay.
So I would like to advise stay fit, do regular exercise, and you should not in your workplace you should not sit at a stretch for a long time. In between you take gap, you stretch your body and do all the exercises and relax yourself. And in your diet you should not take high fatty diets or junk foods. Junk food has to be reduced to the minimum. You should not take your junk food like Coca-Cola or fast foods, like lot of fast food are available. So you should try to avoid that. And second thing is that you should not take in a bulk.
Right.
The food has to be
It has to
taken
be balanced
and in
and
the
a proper
frequent
timing
amounts,
has to be.
frequent amounts, small frequent diets.
Small
That frequent diet, that's important, because Indians we take 3 times food, morning, afternoon and dinner.
But there should be a balanced diet and a balanced timing as well, and it's very difficult for the ones who are going to office or some kind of like work for them to have a balanced timing, but at least they can manage to have that and try to avoid all those junk foods and all, and try to have a healthy food and also a healthy lifestyle, so that you don't need to be like depressed, or you don't need to be like very much tensed about the diseases which is following you or you might be attacked with, but because doctors are there to treat all those kind of disease, and nowadays all the hospitals and things are so equipped well, they are well equipped, and all the treatments are being so advanced, so things will be very much normalized, isn't it? Thank you so much, doctor, for sparing your time and giving us those input and valuable inputs at this point in time. So with this, we have come to the end of the show, viewers, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.